Good afternoon and welcome to our first COVID-19 Vaccine Information Forum. I'm Joanna Wolf and I'm Vice President for Advancement and University Relations at UHD. And I'm very glad to be here as part of this very important conversation. Just recently, the COVID-19 vaccine has become available for all adults, regardless of age or pre-existing conditions. But despite this expanded availability, there are many who still have questions about its safety and efficacy, particularly in communities of color. So this series is the vision of our president, Lauren Blanchard, in an effort to share information with the UHD community about the health and safety of the COVID-19 vaccine. The series begins with today's discussion, but 2 additional information sessions will be provided in the coming weeks, followed by a town hall in which President Blanchard and university leadership will answer questions about our preparations for a return to campus. President Blanchard also has news to share regarding the availability of vaccines on our own campus in the coming weeks. He's been with UHD for just a short time, and we're very fortunate to have his leadership during these very challenging days. Joining President Blanchard as our medical expert for today's panel is Dr. David Persse, Chief Medical Officer for the City of Houston. His career in medicine began with 10 years as a field paramedic and paramedic instructor in upstate New York and New Jersey. After receiving his pre-med training at Columbia University in New York, Dr. Persse attended Georgetown University School of Medicine, graduating with honors in emergency medicine, followed by a residency in emergency medicine at Harbor UCLA Medical Center in Torrance, California. Dr. Persse, thank you for being here with us today. We look forward to your guidance and expertise on this very important topic. Our format today will begin with a conversation between President Blanchard and Dr. Persse. At the close of that, I'll return to ask several questions offered by our shared governance leadership, Faculty Senate, Staff Council, and student government. So I'm now going to turn it over to President Blanchard to begin the program. Thank you.
Thank you so much, Ms. Wolf. I really appreciate that introduction, and welcome to all of you participating with us today. I can't tell you how heartwarming it is that you have joined us, but that even more importantly, recognizing that health and safety and vaccinations, that these are all not only topics du jour, but that more importantly, it's really important for us here at the University of Houston downtown to gain the best perspective that we can as we slowly begin a repopulation process starting in June, and then with the goal of being as fully repopulated as we can by the fall semester as well, and ensuring that we're following all of the health and safety guidelines so that we can be assured of a safe environment here. Dr. Persse, I can't thank you enough. This is actually my first time getting a chance to meet you, and under normal circumstances, I would have found a different way to meet you, certainly in person, but I could think of no better way to engage you meaningfully in the University of Houston downtown's business as it relates to lots of questions that I certainly have received since I've been here. This is only my 3rd week here, and have gotten quite a few questions that I want to make sure that we are engaging some of the local experts, that I've got my perspective on things, but certainly my background is not in the medical field and certainly not in the field of epidemiology. And I know that we have benefited greatly from a lot of the wise counsel and the science that comes with the recommendations that are being made. So we are just thrilled to have you here with us. And I've got a number of questions here. And certainly this is designed to be more conversational in nature. So certainly there will probably be a few other questions along the way, and that at some point we'll turn it back over to Ms. Wolf, who will talk with us about a few more questions that have been raised by other campus constituents. I should say to you, Dr. Persse, that the questions that I will raise all came from our campus community as well. When we invited individuals to participate here today, we asked them, what questions would you like to raise with Dr. Persse? And so we've selected a number of those questions here. So let's start with the first one. And this is more of a softball one. And that can you start by just giving us a good sense of the current COVID-19 conditions of this city, Houston, your view on the future, and what role vaccines you think will play in that future?
Absolutely. And let me first start off by thanking you, President Blanchard, and really the entire UH Downtown community for having me, because this is such an important topic. So it's good that we have forums like this so people can ask the questions. We spend a lot of time listening to what we get from the evening news and what we read on the web, but those are all questions that other people have asked. So I think it's important that we give everyone an opportunity to ask questions. So your first question is, what is our situation? So the situation is, everybody knows where we have been. This is, some people call it this, we've been through 3 waves now, but that wave that we had back in March and April, by comparison to July and what we saw in December, January, what we had back, that was a wave, that was a ripple. That was a tiny, tiny little event that came, the numbers rose a little bit and dropped off. And then in July, we saw big numbers. And then again, December, January, we saw big numbers. When I say big numbers, I'm talking about a combination of the number of people who are getting infected, and just as importantly, the number of people who are becoming hospitalized and what the occupancy was of our hospitals with people diagnosed with COVID disease. So right now, we are on the downslope of this most recent wave. And a lot of people are saying that we've plateaued, and I don't agree with that. I don't think we've plateaued. Our numbers are continuing to go down. They're not going down steeply, but they are going down. And whether you look at the Texas Medical Center numbers, or if you look at the SETRAC numbers, and SETRAC is the Southeast Texas Regional Advisory Council. You can go to SETRAC, SETRAC.org, and there's a link there to a data page for COVID, and it covers a 25 county region. You can look at it by county, and I recommend people take a look at that. I look at it a couple of times a day, quite honestly, because it's fairly granular, and you can adjust the dates. It's a little bit interactive, but either way, they showed that our hospitalization numbers are continuing to trickle down. That's really important that the numbers are going down, because at the same time, what we also know is that when we look at the percent of one of the things that we can use to sort of judge what's going on with the virus in the community, oddly enough, is our wastewater project. And this is something which has never been done before for any other disease process. This is a completely new way to approach public health, where we actually have these devices that go into the manhole at the wastewater treatment plants. And the city of Houston has 38 of them, and it collects a sample of wastewater every hour, 24 times a day, 7 days a week. And then we send those samples off to 2 different laboratories, one at Rice University and the other one at Baylor College of Medicine, where they take each hour sample, they split it into 3 more, and then they test them. That way we make sure that we've got consistency and there's no errors. And if numbers don't match up, we figure out, why. The reason we do that is that people who are infected with COVID disease will excrete it in their stool. So it'll show up in the wastewater. Now, I know that's kind of a distasteful sort of thought, but it's also a pretty aggressive way to measure the illness across the entire community. So where do we stand with that today? What we're finding today is that the amount of virus in the wastewater is pretty much leveled off. And let me point out, if you think about it for a moment, what we're measuring in the wastewater is the people in the community who have the illness, whether they know it or not. And remember, about 40% of the people who are infected with COVID have no symptoms at all, have no idea that they are infected, nor that they're infectious. This is one of the big challenges that we've had. So by virtue of the fact that we know that the amount of virus in the wastewater is pretty leveled off, tells us that the activity in the community of the virus is leveling off as well. But we also have the ability to look at what forms of virus are in there. So we were able to measure how much of the UK variant is in there, how much the South African, how much the Brazilian. And what we're finding is that there's a lot of UK variant in the wastewater. Very little South African, very little Brazilian, which is good, because we don't know as much about those yet, but there's an awful lot of the UK variant. When we talk with our colleagues at Methodist Hospital who sequence every single patient who's tested positive, they find out which form they have. They're finding about the same thing. They're finding about 70% of the patients who they admit are infected with the UK variant. So the UK variant is quite prevalent in our community. That's concerning, because when we look at what's going on up in New England right now and in Michigan and also in Florida, their numbers are rising rapidly, and they're all saying it's because of the UK variant. So this leaves us with a question that I can't answer. It's like, if we have so much UK variant here in Houston, why are our numbers not skyrocketing like they are in other communities? And I just can't answer it. I mean, we see fewer and fewer people, at least in my experience, I'm seeing fewer and fewer people wearing masks as they go out. I see more and more people crowding themselves into restaurants as they go out. And these are the sorts of things that the virus loves to take advantage of. So today, I can't tell you exactly why our numbers hospitalizations continue to go down. The wastewater seems flat, yet we've got lots of UK variant. It may be because we've got a fairly decent amount of vaccine in the community already, And the vaccine does work in protecting people against the UK variant. So, President, that was a really long answer to a pretty straightforward question. I hope you don't mind.
Not at all. You know, and my interpretation of some of what you are stating here really makes it very clear that we have to continue to stay the course, especially with the UK variant that you just mentioned and the impact that it could have, especially in larger crowds, and also recognizing that there are many instances still where people may have been impacted by COVID and don't know it, and that they can still continue to circulate it. So, you know, all of those health and safety protocols, if I'm interpreting you correctly, continue to be important for us.
Absolutely. So I'm vaccinated, but I walk the talk. So if I'm out and about, there's nobody in my office right now, but if there was, I double mask. So I would have both masks on. So I try to walk the talk.
Very important. And another key message, right? Because there is the thinking that if you are vaccinated, then that means that you're fully protected and that you can't harm others. And we just don't want to take that risk, correct?
You're absolutely right. So remember that the Pfizer and the Mrna vaccines are about 95% effective. When that number means they were 95% effective in keeping people from becoming symptomatically ill. We now know, we just came out last week, that the Pfizer is 90% effective in protecting people from becoming sick and even not knowing it. So whether you became symptomatic or not. So that's really good, but it's only 90%. It's not 100%. So still 10% of the folks who are vaccinated and become infected so it's 90% protective. So if you become exposed, there's still a small possibility that you could become infected, but there's actually an increased possibility that you become infected and not know it, and therefore able to spread it. And remember the other thing, the person you are most likely to spread it to is a family member.
Absolutely. You know, you've already spoken to one part of the next question that really had to do with the effectiveness of the vaccine, but we also have a lot of questions around safety, and you know, especially with respect to some of the stories that are circulating around side effects related to the vaccines. Can you speak to this in terms of the safety element related to the 3 vaccines?
Yeah, so thank you. This is my favorite question. So the United States government put a lot of money into vaccine development, and we went from a new virus to having vaccine in less than a year. And so that is understandably got a lot of people scratch their heads. Well, how did we do that? So 2 things occurred. 2 really important things occurred. One was in terms of the mRNA vaccine technology, that is not really so new. If you remember back 10 years ago, we had SARS-1, right? The original SARS that erupted in Hong Kong. It spread to Tokyo. And quite honestly, we as a global population of human beings are really lucky that did not become a pandemic, because that was a terribly lethal virus. And it's amazing that we were able to stop it without a vaccine. But it was at that time when the technology to develop an mRNA vaccine really, it had theoretically, and in some labs it had existed before, but based on that, it really took off. The pharmaceutical industry spent a lot of money in developing mRNA vaccines, but that pandemic didn't occur. So there was no market push to grow it. Then MERS, the Middle Eastern Respiratory Syndrome, developed. Pretty much the same story. mRNA vaccines started getting spooled up and the research was done. And then, so we still have MERS, but in very low numbers. That it turns out that virus is not as contagious. And so we've never really developed the pandemic that we needed to worry about. But nevertheless, a lot of research was done for mRNA vaccines. And then one thing a lot of people don't know is that the cancer industry started looking at mRNA vaccines as a treatment for cancers. And so they've been doing a lot of work. Now you'll hear some talk about vaccines for cancers, and this is what it's about. It's mRNA vaccines, and that is still going through development. So the point is that we've actually been working on the mRNA technology for a decade. So when this came up, all we had to do was get that gene sequence for the new mRNA virus and plug it into a process that had already been established. That's how we were able to get them up. The other thing that's really important that people forget is that 10 years ago, when we had a new virus, sequencing the amino acids of a virus would take a year or more because of the technology. Today, you can do it in 6 hours. So that's the other big advancement that occurred that allowed the mRNA vaccines to spool up. Now, to your question about side effects and so on and so forth, one thing to keep in mind is that the mRNA vaccines actually have a whole lot less stuff in them. They've got the little tiny little segment of mRNA, which is just a part of the viral genome for the whole virus. They've just taken the little bit that programs for the spike protein. They put it in a little ball of fat, and then they've got some preservatives in it, and that's it. So compared to other vaccines, there are far less, the ingredient list is far shorter with the mRNA, therefore far less likely that people would have any problems with it. And one thing I like to tell folks is if you look at the numbers, and I invite anybody to fact check me on this, so get out your pens and paper and go and fact check me. Your numbers may come up a little bit different from mine, and that's fine, but I think the bottom line message will be true. If you look at the number of cases of coronavirus infection of COVID that we have, say here in the city of Houston or Harris County, and you divide into that the number of people that have been hospitalized, it's about 10%. But we know that's a huge overestimate because not everybody who gets infected is diagnosed with it. So let's take that 10%, let's cut it in half, let's make it 5%. Let's cut it in half again, let's make it 2% or 2.5%. And let's take a little bit off of that, make it 2%, because then it makes my back of the napkin math work a little bit easier. So let's say that if you become infected with COVID, you run a 2% chance of requiring hospitalization. Okay, that's 1 in 50, right? 2% is 1 in 50. If you look at the number of people who have been hospitalized, the number of people who have died, and you go to the Texas Medical Center as a good reference for that, you're going to find it's right around 10%. So if I get infected, I've got a 1 in 50 chance of getting hospitalized, and then I got a 1 in 10 chance of dying. Okay, that's got my attention. What are my chances of running into trouble with the vaccine? Well, if you look at it, and now we've got millions and millions of people across the globe that have been vaccinated, the big problem that you're going to get is a type of allergic reaction called anaphylaxis. It's a potentially life-threatening reaction. It turns out it occurs about 1 in 100,000 people who get vaccinated. So let me go for this. I got a 1 in 10, I got a 1 in 50 chance of getting hospitalized, then a 1 in 10 chance of dying, or a 1 in 100,000 chance of having an allergic reaction for which there will be somebody there ready to treat me. I'm taking my chances with the vaccine.
Very helpful explanation of that. So here's another question. Now that vaccinations are open to the public, and this question comes from someone in our campus community. Now that vaccinations are open to the public, what is the outlook on achieving herd immunity?
Yeah, so it's great, right? So we got, we'll get to herd immunity one of two ways, either through people becoming ill or people getting vaccinated. So now it's been opened up so that any adult or really anyone over the age of 16 can get vaccinated. This is great. The things that I worry about there are two things I worry about. One is, I want you to imagine there's 3 links in the chain. There's vaccine supply, there's our ability to set up clinics and get people vaccinated, and then there's the demand from the public to become vaccinated, right? So today, it's vaccine supply as our rate limiting step. I'm hoping that this middle one, our ability to get people vaccinated, is never the rate limiting step. But this last one at some point will become the rate limiting step when people decide that they don't want to get vaccinated. So there's 2 forms of that. One is, the vaccine hesitancy. I'm afraid of the vaccine. I've heard all kinds of horrible things, most of which is not accurate, but nevertheless, it gets around and it scares people. We can work with that. We can educate folks and we can give them the information so they can make an informed decision on their own. And I, for one, I'm never going to tell anybody what they should do. I will say, here are the facts as I know them. You decide for yourself. What I fear, however, that I don't know that I'm going to be able to argue with is going to be what I call vaccine apathy, which is when people say, yeah, the vaccine is safe. I get it. But you know what? I don't care anymore. I think the pandemic's predominantly over. I'm a young person. I'm not likely to get very sick. Why do I care? And so vaccine apathy is the thing I fear the most. And I would remind, I'm going to assume that since this is a university audience, that there's a lot of young people watching. 2 things, well, actually 3 things. One is we do see young people who become critically ill with it. It's rare, but it does happen. Number 2 is it's not just all about you. You run the risk of infecting somebody who, whether it be a friend or family member of same age, but they've got diabetes, they've got cardiomyopathy, they've got autoimmune diseases, you could unknowingly infect them. Or it could be an elder member of your family, right? And then the 3rd thing escapes me actually. I forgot what the 3rd thing was. It'll come to me.
So along those same lines of herd immunity, the question is, what could happen to persons who choose not to be vaccinated? Will they be protected through herd immunity?
Yeah, so if enough of everybody else gets vaccinated, yes, but that's not the sort of thing that I would bank on. And this kind of goes to the whole thing, right? You know, so we believe, mathematically, we believe that we need to be 75-ish% of the community needs to have immunity in order for us to be able to slow down the virus as it propagates through the community. Now, that doesn't mean that it won't. It just slows it down and reduces your chances. It's much like the flu, right? We get the flu every year. A lot of people got the flu last year. A lot of people get vaccinated, yet it still spreads to the community because herd immunity is not a light switch. It's not an on or off. It's a rheostat. So you can get more or less herd immunity depending on how much immunity there is in the community. So if we have a bunch but not enough, yeah, you can still get infected.
So you led into the next question, which is centered on the fact that, okay, I've been immunized. What's the likelihood that I could still become compromised, meaning that I could still end up with COVID-19 after my vaccination?
So as we pointed out, the Pfizer vaccine, for example, we know is 90% effective at preventing you from becoming infected at all. So that's not 100%. Mm-hmm. But in that equation, to your question, part of the ability to answer that is not only how well does the vaccine work for me, but how many of the people around me are vaccinated. If I've got a vaccine that's 90% effective and I'm surrounded by people that are also vaccinated, there's almost no chance that I'm going to get infected. If I've got a vaccine that's 90% effective, but nobody around me is, I'm running a pretty decent chance of getting infected at some point. One of them is going to infect me. And if we go back to the previous question, the third thing I want to remind folks of is that there's also this issue of the long haul symptoms that people are dealing with. There's another reason that I would want to make sure that I get vaccinated, because we don't understand that very well at all. And in the neighborhood of a third, depending on where you read, the highest number I've seen has been a third. I read 15, 20% is a common value for people who have long haul symptoms, but I've seen it as high as a third. I'll tell you what, I do not want to get infected with this, right? I don't want to get sick. I don't want to die. I'm vaccinated, so I don't think that I would die, but I don't want to get sick. I don't want to be hospitalized. I'm becoming increasingly concerned about this long haul syndrome that we're hearing about. It sounds like it's fairly debilitating and it's pretty miserable. So anyways, back to you, sir.
So, along those lines, and this will not be a question per se, but you might want to figure out how to address it if it is somewhat of a concern for some of our community members. And that is, if you are already suffering with any type of chronic illness, should that prevent you from going to get the vaccination because of the thinking that it could exacerbate it even further, as opposed to really helping to prevent them from getting the disease, getting COVID. But tied in with that is the big question that we continue to hear. Once vaccinated, if there's an estimate of time of how long the vaccine remains effective, we're hearing more and more about some indications that it's 3 months in length, it's a year in length. Is there any science behind this that you can share with us?
So yes, so what we know is that for those people who have been infected, we start seeing them become reinfected as early as 3 months. So that's where that 3 month is coming from. We're also noticing that people have been infected, when we test their blood, there are varying levels of persistent antibodies, their protection, it varies. And what we're not finding is any rhyme or reason as to who has lots of antibodies 4, 5, 6 months later and who has little. It doesn't really seem to follow age. It doesn't really seem to follow pre-existing illness. It seems to be a little bit of luck at this point as to whether or not you're going to have persistent immunity after you're infected. The other value that you're hearing in terms of how long the vaccines are effective is a growing number. In fact, Pfizer just came out last week and said that they can now prove that their vaccine is protective for 6 months. But that's only because they've had it out in the community for 6 months. So 3 months from now, they may come out and say it's good for 9 months. And then 3 months later, they may come out and say it's good for a year, because we just haven't had the vaccine around long enough. So a lot of confusion about those numbers, and I hope that I gave a little bit of insight as to where that confusion's coming from. There's no bad actor here. We're just learning. As you know, this is one of those things. I joke that we're building this ambulance as it's going 60 miles an hour down the freeway. So give us a break.
Yeah, building and flying the plane, huh?
Yeah, that's
I
right.
get it, no doubt. So there is the mindset as well in terms of some of the information that I'm hearing here, that if the effectiveness is only for a 3-month period of time, then there's an expectation that a person will have to go back and get vaccinated again at that 3-month mark. True or false?
So at this point, false. Like I said, Pfizer just came out yesterday and said, or this week rather, and said that that they know that it is effective for 6 months. And as I pointed out, I anticipate 3 months from now they're going to come out and say it's good for 9 months. And with mRNA vaccines, we just don't know. There are some vaccines, as you know, when you were a kid, you got a couple of your, measles, mumps, and rubella shots that are pretty good for a lifetime. So we don't know yet with mRNA vaccines. They may give us lifetime immunity. They may not. We're going to have to wait and see. The other spin on that, however, is again, getting back to the question of the mutants. So one of the reasons that we need to get a new flu vaccine every year is because the flu virus it travels from the northern hemisphere to the southern hemisphere and then back up again with the seasons. What happens is, for those of us in the northern hemisphere, when it goes down to the southern hemisphere, it goes through enough genetic manipulation that when it comes back up again, the vaccine I got last year doesn't protect me very well against this year's version. It's entirely possible we'll see that same phenomenon with COVID. The only thing with COVID is not very seasonally dependent like the flu is. So again, we're gonna have to wait and see what happens, but we may need to get a booster or a new vaccine at some point because the virus will have had enough genetic drift. And a couple of terms for it, there's genetic drift and genetic shift. So genetic drift is when the virus changes just a little bit, and that's what we're seeing with some of these mutants. Genetic shift is when it dramatically changes. So that's what happened to cause this situation in the first place. The SARS-CoV-2, the meat of the current virus that causes the problem existed in bats for decades. It then got into another animal. We think it was an anteater, a family in the anteater, where it had a shift. There was a dramatic change in the genetic makeup that made it then something which could infect humans. Prior to that, it couldn't infect humans. So a couple of terms there for people to learn: genetic drift and genetic shift.
Very important. Thank you for that. You answered one of the questions, that do you anticipate that annual COVID-19 vaccines will be necessary going forward? And so I appreciate your response to that already. This morning when I was watching the news, the interesting element is the battle in higher education right now to determine whether or not we should require vaccinations for repopulation of the campus. And obviously with a focus on students, but also recognizing that such a requirement could be meaningful for faculty and staff as well. We were under the guidance, when I say we, not only in my role here at the University of Houston downtown, but that I just came from California as well. And a lot of the information we were receiving led us to believe that right now, until the point in which these vaccines really do get the ADA approval, that we're still under emergency use authorization, and that we would have some legal challenges if we were to require the use of require the vaccination within not only just the university setting, but any other work setting. Where does this fall now, especially in light of, we're hearing like the University of Maryland made their announcement today that they will be requiring students to be vaccinated in order to either engage in in-person instruction or in housing or in athletics. Is that legal?
Yeah, so good question. I'm not an attorney, but I was under the same understanding that you were, that under the emergency use authorization, it couldn't be mandated by an employer. However, we have seen employers, University of Maryland, and even here in Houston, the Houston Methodist Hospital System has recently come out and said that they're going to be requiring it of their employees. Now, so Methodist, they have for decades been requiring the flu vaccine, so that employee population is not, this is nothing new to them. But nevertheless, I'm sure they had their attorneys look at, both the federal law and the Texas law And apparently they think that they can mandate that. So, we'll have to see. I anticipate somebody will challenge that and we'll get a court decision.
That's helpful. So locally, COVID-19 testing rates have decreased. Why is it so important to get tested if one develops COVID-19 symptoms? Does early detection still give the patient a better outcome?
So getting tested once you have symptoms, or even if you have been someplace where you feel you've been at risk, because remember, 40% of people who are infected have no symptoms whatsoever. And also remember, the person you're most likely to infect is going to be a member of your own family. So if you have symptoms and you get tested, two things. Number one is you now are able to isolate yourself so that you don't infect your family members and you protect those around you. And number two is that should you get sicker than you think is just, sick, you start getting really sick and you go to your doctor or you go to the hospital or wherever you should go for seeking help. If you can tell them, I just tested positive, that's a game changer for them in terms of trying to treat you more efficiently and early. So there's two good reasons to know. But I also want to remind folks, if you've been someplace where you felt uncomfortable, that you may have been exposed, 40% of people are without symptoms, yet able to spread it. So I've made it my routine. I get tested about every 3 weeks. I've been vaccinated, I continue to get tested. I'm out and about, I go to meetings. I'm obsessive compulsive about wearing my masks. I'm trying to stay as far away from people as I can, but sometimes I can't. So it's now for me, it's routine to get tested because I am not bringing this home to my wife. That is not happening.
So this really rounds out my questions. Remember that I'll turn it over very shortly to Ms. Wolf, and she's got some additional questions based on faculty, staff, and students as well. What's on my mind is really understanding what type of guidance to provide to our campus. I'm certainly an advocate for the immunizations, and certainly I'm in the same position as you in terms of making sure that those around me, that I will not impact them or compromise their health, but my own self-care as well, matters a great deal. And I know that, culturally, that there are some differences of opinions as it relates, I'm sure, also based on religious factors, et cetera. But on the cultural front, is there a message that we can give that would allay some of the anxiety, especially as it relates to some of the more historical types of vaccinations in the past that obviously had a disproportionate impact on people of color? Where are we today as it relates to these kinds of vaccination regimens compared to the past, and why the past shouldn't perhaps lead us to believe that the right decision today is not to get vaccinated from a cultural perspective?
Yeah, so great question. And I'm going to give you the best answers that I can. I think that it's tragic, and they were tragic, the sins of the past have come to light. And today, I think that we are fortunate in that there is incredible scrutiny to make sure that those are not being repeated. There's no guarantees, but if somebody were intentionally trying to do something like people of the past did, I can't imagine that they would get away with it. There's just too much attention, too much scrutiny, all of which is absolutely tragically, unfortunately necessary, but it does exist. So that's one thing that I would say. And we're in a bit of a difficult situation from a public health standpoint, because the same communities that you're talking about who are maligned in the past are the ones that, for many of those same reasons, are the ones that are at greatest risk today and deserve the most attention and the most support and the most protection. And so, there's an inherent conflict there, right? And so, again, going back to what I said earlier, is that I think that the best thing for us to do is to educate people as honestly and as transparently as possible, respect their ability to make a decision for themselves, and pray that they make the best decision for themselves, whichever way they decide. And that's what I would say at this point. And I'm also torn because you raised earlier the issue of employers mandating. Part of me wants to, really get behind that and rah-rah, But another part of me fears that the more you force something upon someone, the less likely they are to accept it, or to be accepting of it, I should say. So I haven't yet decided how I feel about the mandates. I respect those employers who do mandate it, for example, the Methodist hospital system. But I also think that you need to be really in touch with your employee base and make sure that you wind up in the right place and not creating more problems than you had intended. Does that make sense?
Tremendous sense. And especially even on the education side, which is the purpose of these forums. And really cannot thank you enough thus far in terms of the questions that really a lot of our campus community members are grappling with. We fully understand what we have been through this year, and the reticence to figure out how we might repopulate, and should we, and what impact it's going to continue to have on our families and our own individual lives. I mean, those are all perfectly understandable questions, for which I believe wholeheartedly that the only way to begin to work our way through this is in better understanding where we are with health and safety protocols, with vaccination efficacy, and overall, just really starting to see the tremendous difference that we believe to be on the horizon. When I spend time with medical experts and scientists like you, it gives me the full assurance that yes, we are on our way. We haven't arrived yet, but we are on our way, and that we really have to continue to play our part to give that level of support for the general community on health and safety. So I can't thank you enough for your responses thus far. We've got a few more questions. I'll turn it over to Ms. Wolf. I'll ask you, Dr. Persse, as well at the end of the questions that Ms. Wolf will pose. There may be one or two questions that you were anticipating that we didn't get a chance to ask. So I'd like for you at the end of our discussion today, if there are such questions, please feel free to raise them and answer them. Can't thank you enough, Dr. Persse. Joanna, I'll turn it over to you now.
Great, thank you. So I want to jump right in and begin with some questions that were presented by our Student Government Association. One of those is, are vaccines free, or do I need an insurance provider?
So excellent question. The vaccine should be free to you. Now, depending on where you go, they may ask for your insurance information. There is an allowable administration fee. It's very cheap. I want to say it's less than $20, but they, if you don't have, you as an individual should never be asked to pay a penny, not one. If you have insurance, they can ask your insurance to pay for it. Medicaid, Medicare will pay it. But if you don't have any insurance, they cannot ask you for it. So they may ask your insurance information, but they should never ask you for a penny. And if they are asking you for money, all kinds of scary thoughts come to my mind. So, yeah.
Okay. And leading, connected to that, about legal status. So what kind of information will they ask for when I go to get a vaccine, and will my legal status come into question at all?
Yeah. So we do ask for contact information. We don't ask about your legal status. We ask for contact information for a couple of reasons. One is the information that you've been vaccinated, we put into MTRAC2, which is the state's database for tracking, how many people have been vaccinated. And that's regardless of which vaccine you get. And certainly for the Pfizer and Mrna, we need to track you so we can get you your second dose. But that is not shared with law enforcement. It's not shared with the federal government. That is all state level, and we don't ask about your status.
Okay, great, thank you. And a question from our staff council. I believe this will be for Dr. Blanchard. Will the university become a vaccination site in the future?
A permanent vaccination site, likely not. But opportunities here on campus for faculty, staff, and students, and perhaps parents and grandparents of students to come right here to UHD to receive a vaccination. It's highly likely. Stay tuned. You'll be hearing something very soon.
Wonderful, thank you. With the new variants and strains that are being uncovered and clearly are evident in the Houston community, how long do you expect that social distancing and masks will continue to be a requirement?
Well, that is a great question, and I'm going to give you a lousy answer. So I think it kind of like the question really is, when is the pandemic over? right? And the cynic in me says that the pandemic will be over when nobody is taking vaccine anymore. Nobody wants vaccine anymore. Because at that point, we will have done everything we can. And there's nothing more we can do. And so at some point, society will reach the level where we're just comfortable with things as they are. And I look back at the flu. So remember, every year, 30,000 Americans die from the flu. And somehow this society has said that's okay. And we accept that. And we don't wear masks and we don't social distance for the flu because we're okay with 30,000 Americans dying every year from the flu. Now, the reality is the vast majority of those are really elderly patients who've got a lot of health problems. Now, I don't think that that makes it okay, but apparently as a society we do. It's also around 200 children die from the flu every year. And again, as a society, we said it's okay. So we will reach that with COVID where we think this is okay. Whatever it is, that's when the pandemic will be over. And I think that's when the CDC and the federal government will say, okay, time to stop social distancing and stop wearing masks. And I think that will come right when we have vaccine and nobody wants it. That's the cynic in me. I apologize.
And Dr. Blanchard, sort of pairing with that, what do you see in terms of the UHD community and requirements for masks and social distancing? Any sort of foresight on how long that might last?
Well, I can assure you that I want to make sure that we are being very mindful of our own health and the health conditions of others. And certainly as we start the repopulation process here as early as June and then working our way to become increasingly repopulated by the fall, there will be an expectation. There is an expectation for following all of the health and safety guidelines. That includes the wearing of masks, that includes all of the different stations that we will have available for regular cleansing of hands, the cleaning regimens that will happen in classrooms, the social distancing within elevators, within stairwells, you name it. We have already begun that work that when you come here, you will see very clearly how we are going to be following and adhering to these kinds of protocols as strictly as we possibly can. For how long? For as long as we need to do it, and until the day when we hear from experts like Dr. Persse to say, you can now get back to regular life. And I would imagine that that's not going to be this fall, but I continue to hear that we're working our way through this and that we hope that it'll be as soon as possible.
Great, thank you. And a question from our faculty senate. Of course, one of the major concerns among the faculty is the issue of having unvaccinated students in the classroom. Will faculty who have received the vaccine be safe? And what about the reverse of that, faculty who do not get vaccinated and their threat to students? And Dr. Persse, I know you certainly answered this in part before, but it is such a pressing question. I want to put it out there again.
Yeah. So it's a hard question to answer because there's so many variables involved, right? So the other thing that which we haven't touched on is the Johnson & Johnson vaccine is in the 75-ish% effective, whereas Moderna and Pfizer are in the 95-ish neighborhood. Let me just put one thing in a little bit of perspective. So the annual flu vaccine, like many vaccines, is in the 50 to 60% effective rate. So had Johnson & Johnson come out first at 75% effective, we would have been thrilled. But Pfizer and Moderna came out at 94, 95%. And so that sort of set the standard. So everybody's thinking that Johnson & Johnson is a lesser, and it's really not. It's actually highly effective compared to most vaccines. But to your question about faculty members, if they're vaccinated and most of the students are vaccinated or not currently infected, because the amount of viral activity in the community has gone down. So this week in the city of Houston, our positivity rate has dropped to 8.1%. We've been as high as 30. So it's dropped to 8.1%. The mayor keeps wanting us to get down below 5. So we're getting close. So if the positivity rate in the community is pretty low and the faculty member is vaccinated, they're probably in a pretty safe environment. If the positivity rate is high and they're not vaccinated, then the faculty member is taking a greater risk. You can't quantitate, there's no way to put a number to it. It's all relative. And so I think a lot of it has to do with keeping that positivity rate down. Because, for example, as President Blanchard pointed out before, not everybody is going to want to get vaccinated. They may have healthcare reasons, they may have religious reasons, they may have whatever reasons they have. They may not want to get vaccinated, they may not be able to get vaccinated. They may not, their doctor may have advised them specifically that you shouldn't get vaccinated because you were allergic to a vaccine that you got before, which puts you at high risk for having a problem with this one. So that being the case, the real answer to it is if we can keep the positivity rate in the community down, and if we can do that, then everybody's safe.
Great,
Safer,
thank you.
I should say, safer.
So I want to go back to another question that was asked by the Student Government Association. Students asking how they can reassure their parents or older adults in their families that the vaccine is safe. Any particular tips around providing that input to family members?
So yeah, I would, well, one great place to go is to, read from responsible places on the web. So I gave out the value earlier that about 1 in 100,000 people who get vaccinated are having the anaphylactic reaction that we worry about. And there've been no deaths. Now, depending on where you read, and I've already looked this up, I was told by the story, I went and looked it up, sure enough, it's there on the web. There is a story on the web of a guy who got vaccinated. And while driving home, he was stopped at a red light. He got rear-ended by a pickup truck and was killed. And the author is blaming it on the vaccine. I mean, there's some ridiculous stuff being floated around out there. And you just, they're just, so you have to be careful what you read. But when you read from responsible places, the Mayo Clinic, the CDC, you name the big university medical center, they're not putting out gibberish, right? They're putting out, Bob's anti-vaxxer group is probably not where I would get my information from. But what we're finding is the vaccines, like everything else in life, nothing is 100%. Are there people that are having serious anaphylactic reactions to the vaccine? Yeah, there are a few, very small numbers. Like I said, around 1 in 100,000. It's that is going to happen, right? But they're being watched. This is why you got to stay there for 15 minutes, so that if you should be somebody who has that reaction, we can treat you for it. So there's a protection level there. To the other part of the question, which is, the part that Dr. Blanchard hinted at earlier, or didn't hint at, but, pointed quite directly, is that all of the things that the medical industrial complex has done to take advantage of certain populations in the past, I would like to believe in my heart that that's just not possible today because we have so many safeguards in place. And I don't mean safeguards from the FDA necessarily, although those are absolutely there. It's safeguards from the general public, watchdogging all this stuff and making sure that nothing is going awry. We have now got literally, was it like 15% of the US population has gotten at least one dose? You know how many millions and millions? There's 330 million people in America, right? So 15% is what? There's like 40, 45 million people. Okay, you're not able to vaccinate that many people and have a problem be hidden. So I would offer that.
Thank you. So I think that comes to the end of our questions, and I'm going to turn it back to the two of you if you have some final remarks, and then I will close us out.
Thank you so much, Ms. Wolf. I appreciate this and really appreciate the questions from our students, our faculty, and our staff. And Dr. Persse, you're the first of three in terms of the conversations that I'll be having. So I know that our conversation today will likely spark a number of new questions that we fully are ready and prepared to be able to present to our next medical expert that we'll be engaging very soon. Dr. Persse, I raised the question earlier that, if there are any questions that you thought we should have asked at this juncture, but knowing that obviously we'll have two other shots at this with other experts, local experts. Is there anything in particular that comes to mind that you would think would be really important to convey today that you can just kind of wrap into your final remarks as we close this out?
Well, first of all, let me once again thank you, President Blanchard, and the UH community for inviting me and for having this, and the next two as well, to educate people, because education is the answer, right? I would also ask, those that are watching, as you leave here today and you go and you talk to other folks, understand that, to some degree, from a messaging standpoint, we're trying to thread the needle, which is that, we need to maintain enough of the conversation about the fact that the virus is in the community, that we do have variants in the community, people are getting infected. And while our hospitalization rates are coming down, over 100 people were admitted to hospitals just yesterday in Harris County alone with a new diagnosis of COVID. And 10% of those are at risk of dying. So there's the scary part of the message. the good part of the message is we do have vaccine available. And then if you wear your mask and you social distance, you can be, pretty well protected. So we're trying to balance the message. We don't want to make it sound so rosy that nobody gets vaccinated, but we also want to make it so scary that people get tired of listening to us and just tune out altogether. So we're trying to balance that message. And so as you go forward and you have conversations with folks, make sure that you keep in mind it's really about educating people about the facts and then allow them to make the right decision. And we don't want to sway them too far one way or the other, because that's not being honest with them. That would be my closing comment.
Great, thank you.
Thank you so much. First of all, for your participation today, Dr. Persse, cannot thank you enough, and not just on my behalf, but on behalf of the entire University of Houston downtown community. We're really, really happy that you were able to join us. But I would even say, I want to be one to join the chorus of gratitude for the longer haul work that you've been doing. Today is just, I know, a quick snapshot of all the work that you have been doing over the past year or so, and that I want you to know that what the education phase of this and what you have contributed today really has not in any way fallen on deaf ears. The work that you do and how you help to keep us informed not only educates us, but it guides us. And so I just want to say thank you very much. We look forward to the continuing series on this, but that more importantly, we want to make sure that we're doing everything as right and precise as we possibly can to ensure the health and safety of all of our campus constituents, and also ensuring that people really understand the importance of vaccinations. So today was round one, could not have been any better than starting with you, Dr. Persse. Thank you so much. And I think that as I'm being guided here, that I'm giving you a gift of 8 minutes back of your time, Dr. Persse, as well as to the campus community. Thank you all so much for joining us. Dr. Persse, again, our great gratitude to you.
Oh, thank you.
Thanks to all of you for joining us today, and information about the additional forums will be available on the UHD COVID website. So just pay attention there and you'll have those additional opportunities. Thank you so much. Goodbye.